It looks like this. I think we have started the window. Hello, everyone.
Hello.
Yes, we will wait some minutes and then we will start our presentation to see maybe someone else will join us. So I will start sharing the screen and, and we'll share my. Probably like this. Is it fine? Can you see the screen well, Daniela? Okay. Okay, maybe we can start by introducing ourselves, then carry on. And if someone will join us, then it will be, yeah, on a later stage. So, good afternoon, everyone, and very welcome at our today's live webinar. We're very happy to have you here with us. And I think especially this webinar would be interesting as you will have a chance to hear firstly from our colleague Daniela, who is an Italian nurse working in the Netherlands, ask her questions. By the way, you can ask questions in the QA section or in chat and at the end of the presentation, we will answer your questions. So let's start with introducing ourselves. I mentioned about my colleague Daniela. Um, she's an ambassador at EMTG Healthcare, and she's also a registered nurse in Amsterdam in the Netherlands. And she's working in the Netherlands for how long, Daniela?
Hi, everyone. Yes, as Natalia said, I'm an Italian nurse and I've been living and working in the Netherlands for the past 5 years.
Uh-huh. Thank you, Daniela. And myself, I'm Natalia, and I work as a talent acquisition specialist at EMTG Healthcare. And I have experience for more than 10 years working with healthcare professionals and helping them to relocate yeah, to find positions abroad. So what would be our talking points today? So firstly, we will start with the information why you should choose the Netherlands as your next career destination. Sorry, I will close something. Then we will continue with information about nursing in the Netherlands. I will explain you more about the structure of Dutch healthcare, about the roles and the responsibilities of the different healthcare professionals, and also I will mention about the salaries in the Netherlands. What is also important, why should you choose EMTG Healthcare as your as the company that could guide you to the career in the Netherlands. And I will talk in details about the Dutch course at Academia Neerlandesa, which is located in Spain. And the most interesting part, as I mentioned, would be the interview with Daniela. Okay, then let's start. Why should you choose Netherlands as your next career stop? So probably you know about Netherlands, you know some facts about the Netherlands. You know, uh, Netherlands by its wonderful tulips, windmills, yeah, cuisine, sustainable energy. But when we talk about a place to continue your career and a place to work, these aspects are very important. The first one is the high quality of life. There you will feel safe. Uh, you will live in a yeah uh, in a fish in a city or town with efficient public transportation, with close access to nature. So in the Netherlands, life is designed to be comfortable and also fulfilling. So you will also have a work-life balance. You will also benefit from a strong healthcare system. Dutch healthcare system is ranked on the third place in the world for healthcare quality, according to the Numbia Healthcare Index. It was ranked in 2025. It was just behind Taiwan and South Korea, and had countries like Austria, France, and Japan. In the Netherlands, you can benefit from accessible and efficient care. The medical staff is highly qualified, um, and the services are patient centered. You will work in international work environment. Some healthcare professionals, they come from different countries. Therefore, yeah, they know how it is to start and work in a new healthcare system in a new country. So therefore, your colleagues will also help you to integrate into the working environment and into the society. Um, and there you will also benefit from the career growth. You will mm, you can pursue your career doing further specializations, or you can have leadership roles, or if you're interested in the academic development, then you are welcome to do this in the Netherlands. So in the Netherlands, you can advance your career. Mhm. And next slide is about the nursing in the Netherlands. Dutch healthcare system. In the Netherlands, everyone has healthcare insurance. The healthcare insurance, it's called Universal Social Health Insurance. It blends public oversight with private insurance provisions, and it shows that it's quite successful. Um, so the universal coverage, it's free for children under the age of 18, and it's mandatory insurance for all the residents. As I mentioned, so where do the finances come? Partly comes from the income of the residents, and also part comes from the government support and fixed monthly premiums. How the care system is structured. So firstly, you start with the primary care with the GPs as gatekeepers. Then it comes to the secondary care, where we have specialists, appointments via GP referrals, and after that, territory care, where more advanced treatments uh, um, when there are more advanced treatments in university hospitals. Mhm. And I don't know if you have heard that, but in the Netherlands, there is a nursing level system. The Dutch nursing system is structured across 8 levels, with the most practicing nurses falling between 1 and 6. I will go a bit deeper with each level. So firstly, it's a care assistant with the training of 1-2 years, where the person helps with the basic support and personal care. Then there is a level 3. It's called nurse assistant. So here, uh, yeah, healthcare specialist can have basic nurse care, or offer basic nurse care. Um, so it combines personal care also with the basic nursing tasks. Um, Here, for example, wound care or catheterization, we can the professional could perform. After that follows level 4. At this level, it's a fully qualified nurse. So the training must be 4 years, and the nurse uh, should perform all the tasks of the nurse. Then we have level 5 and level 6. Just 1 second. Oh, trying to move it, but anyway. So here it's also the task of the nurse, plus more complex care and also leadership roles. Here it's essential that the professional has a bachelor degree of 4 years. I would say that most nurses, international nurses, they start at level 3 and 4, and then they end up at level 5, 6. Some of them, of course, could continue to level 6, 7, and 8. It's a nurse specialist, a specialist who can prescribe and diagnose certain medication. Here, additional training is needed. And after that follows academic levels. So educators, researchers, nurse specialists, masters, and um, PhD levels. Oops. So, what is important to talk about the salary in the Netherlands? So in the Netherlands, here you can see what is the scale of a salary of a helpender, care assistant, um, and then assistant nurse, and to registered nurse. Of course, it will depend, the salary will depend on the education, on the years of experience. But we can say that for the helpender, you could expect to have 30 to 37,000 euros gross annually. For assistant nurse, it's 37 to 48,000 euros gross annually. And for registered nurse, it's starting from 38 to 58,000 euros gross per year. Also in the Netherlands, you could benefit of end of year bonus if you work on weekends or night shifts. You could also have extra pay for this. Mhm. And what is the career path of a European nurse in the Netherlands? As I mentioned before, so most nurses, they start at level 3, because in order to work as a nurse in the Netherlands, you need to be you need to have a big registration in the Netherlands. Um, So until you don't have this registration, you could be assigned as a nurse assistant. And then when you have this registration, you will continue with the level 4 nurse and level 5 or level 6. So job offers in the Netherlands. So uh, our company, MTG Healthcare, offers positions for nurses, assistants, and nurses throughout the Netherlands. So we have positions mostly in elderly care facilities, in home care, in mental care facilities, also hospitals and clinics. And the positions could be in the towns and cities around across the Netherlands. So it could be Heerenveen in the northern part of the Netherlands, central part, Leiden, Eindhoven, or Maastricht. So depending on the market, on the positions that are available by the time you're applying. So, another important factor, why should you choose EMTG Healthcare as your partner in your relocation? So, first, I would say that the company is reliable because the company has 14 years of available experience, and the company has helped for more than 900 healthcare professionals to relocate and to work in Holland. The company offers career support. So, firstly, you will have a support in finding a position in the Netherlands. You will also have a job mentor who will help you with your first work, and you can address him any issues if you have. So you will get this support during your first year in the Netherlands. We will also guide you towards the obtaining the Dutch nurse registration. In the Netherlands, we will assist you in finding the house and also other services that you would need when you relocate to the Netherlands. And of course, what is important, you will have a Dutch language course organized by Academia Neerlandese. And after finishing this course, you will reach B1 level of the Dutch language. And now let's get closer to the Dutch course and culture course at Academia Neerlandese. Academia Neerlandese is located on site in Spain. There you will benefit from accommodation and meals. You will study up to 4 months of very intensive training from 0 to B1 level. You will study every day from Monday till Saturday. You will have only one day off. You will study from 9 till 6 o'clock every day. It will be very intensive, but at the end you will get good results and you will reach the desired level. And also during this course, you will have culture integration. So the teachers will explain you more about the cultural differences of the Dutch, of the Dutch people. And you will also focus on medical vocabulary, on real life scenarios, and also cultural understanding. So it's quite a nice location for the course. And most participants, they mentioned that during this course, they met some friends there, and they are still friends until this time. So the next part, I would say quite interesting part, the interview with Daniela. So Daniela, maybe you can turn on your mic.
Yeah.
Mm-hmm. So we will have I have some questions prepared for Daniela. I will ask her some questions, but please feel free to also write some questions in the QA section. So Daniela, maybe the first question um, would be about your motivation. Why have you decided to relocate to the Netherlands from Italy?
Yeah. So after my nursing diploma, I've worked in Italy for 1 year. And since the beginning of my work life, that's very different from the student life. I've decided that I wanted to relocate outside of Italy. Also because the Netherlands has always been very attractive for us nurses, especially for the possibility to have a good career and to grow. As you said, you begin from level 3 or 4, then you can grow up to 5, 6. There are a lot of possibilities and possibilities to have a good career. So that's why I've always been attracted by the Netherlands.
Mhm. And you're still in the Netherlands, so are you in Amsterdam?
Yes, I am. I live about 30 minutes from Amsterdam. And as you said, it's very easy to reach by public transport. Now I've also bought a car. I didn't have my own personal car in Italy, so that's also a step further in personal growth. Um,
Mhm.
and I'm currently working for a vaccination clinic that helps travelers with vaccinations, with medication as prevention for tropical diseases. So that's my specialization now.
Mhm. Okay. And did you do any extra training to have this post?
Yes, I did. Because in the Netherlands, every specialty has its own specialization, and it's fully covered by the company that hires you. So I didn't have to spend any money for my specialization.
Mhm. But was it your choice to become a vaccination nurse?
Yes, it was my choice
Uh-huh.
because I began via MTG for a home care institution, and I liked it very much. I've worked for the home care institution for like 3 years and a half, and there they also offered me through MTG. And after the 18 months contract with MTG, I decided to stay with the home care company, and they've offered me various kind of courses of specializations. So I also got fully paid from the company a specialization in nursing leadership. That's
Mhm.
something that doesn't exist in my country. And then after that period, I've decided to apply for something else because I love traveling. Um, and for example, in my country, in Italy, only doctors can prescribe and administer vaccinations. While in the Netherlands, we are fully trained, extra trained, and we can do it by ourselves. And
Yeah, so
what
it's
is good is
impressive. I
that,
think this is the biggest difference, I think, with
sure,
other countries in the European Union.
sure, we are trained. So now I work on my own. I have my own uh, consultation room, so I can decide by myself. But you're never alone because there are always doctors, colleagues, nurse specialists that I can call 24/7 if I have questions.
It's very important. So the teamwork, yeah, it's very important in your next career. Okay. And do you remember your first day when you just arrived in the Netherlands and your first working uh, contract? How was it? What impressed you most?
Yes, I remember it very well, and it was a very well welcome. Um, because when I came to the Netherlands, EMTG had already arranged shared apartments with other colleagues of mine from the Accademia Neerlandesa. So we already knew each other. And at the time, I shared the house with two more people, two more colleagues. And after that, in the first month, almost every day, we had a mentor calling us of coming with us to work, to see and to make sure that we would get the right amount of attention. and that our integration process had a good begin, let's say so.
Yeah, so it's good to have this assistance of a job mentor, especially when you're new to healthcare. You have a lot to learn, and especially when the language is different than your mother tongue. Hmm.
So,
Okay, and tell us about your journey learning the Dutch language. How long was it? How was it?
my first advice for every colleague that wants to enroll in this course is don't be scared about the Dutch language, because it may seem difficult for someone who doesn't speak Dutch. But the program at the Accademia Neerlandesa is very intensive. So in 4 months, you will go from level 0. So you will learn all the basics from numbers, how to tell what time it is, how to spell the alphabet. After 4 months, you will get your level B1, B2, depending on the work that you're going to do in the Netherlands. And the teachers, it's very important to say, are Dutch mother tongue speakers. So you can also get the real Dutch accent. And they're very competent, and it's very intensive, but everyone can do it.
Yeah, and for you, this Dutch accent, was it difficult to acquire this accent?
It's different. So in the beginning, it's of course you have to adjust to the accent, to like the different kind of pronunciations, but it's not impossible.
Uh-huh. So you came to the Netherlands and you already had B1 level of the Dutch
Yeah,
language. Am I correct? Uh-huh.
sure.
Then maybe you can tell what happened next after you came to the Netherlands.
Yeah. So at the Accademia Neerlandesa, as you said, you reach a level B1, B2. Then you come to the Netherlands, and every foreigners has to take an official examination of the Dutch language. It's called the NT2, and it means a Dutch Netherlands als second language, and it's mandatory for the big to inscribe yourself to the big registration. That's like the nursing board, the healthcare professional board. So when I came to the Netherlands after the language course, the first week was needed like to adjust ourselves, to see like where the supermarket, to buy or to rent a bike, and to go to the town hall, for example, for the registration and to get the BSN, that's the social security number. So it was very fine to have a mentor, a Dutch person that explained us every step to take. And then after around 10 days, 2 weeks, we went to the university. There are various universities that are used to let people take the language course, the language exam. And then we took the exam.
Yeah, this is important to mention that this B1 level exam will be held only in the Netherlands. It will not
Yeah.
be held in Spain. So only at the Dutch University in the Netherlands. Hmm.
But I
So you
have to
passed
say,
it, no?
yeah. In my group, everyone passed it. And the Accademia Neerlandesa has a success rate of around 97, 98%. And what is also fine to know is that if you fail a part of the examination, you can repeat it after a few weeks.
So you can prepare yourself again and pass the exam. Hmm. Okay. And what is your current level of the Dutch language?
I would say that after 5 years, my current level would be a C1,
Uh-huh.
because it's important then to practice the language.
Yes. And at your first working place, mm, did you manage to practice Dutch from the day one? Or were you nervous?
Yeah, of course, you are, as you said, a little bit nervous because you know the theory, you pass the exam, and there are a lot of simulations at the Accademia Neerlandesa that prepares you. But then it's a little bit difficult in the beginning because you think in your own language and you would like to express yourself in the Dutch language, and it's not always possible.
Mhm. Yes, I
If you
agree.
practice daily, then you can do it.
Hmm.
Sorry, one moment, because someone's here ringing at the door. I'll
Okay,
be
no
right back.
problem. Yeah, take your time so we can be still here. And um, yeah, so please write your questions if you have any. Hmm. Nice to meet you. So Joseph is here, Irene, Miranda, Tiago, Elisa, Angela.
I'm back.
Nice to have you all there. Okay, so okay, let's continue. Yeah, so how many hours per week do you currently work?
Okay. When I began through MTG, I used to work 32 hours.
Hmm.
Now I'm working 40 hours, but
Hmm.
that's my choice
It's your
because the
choice.
standard working hours in the Netherlands are 32, 36. But now we're
Mhm.
working more flexible. So I chose to work 40 hours and to have 3 days off per week.
Aha. So you work more during the days you work, and then you can
Yeah,
afford to have 3 days off a week. Hmm.
yeah,
So this is also the difference that the Dutch healthcare system offers, that you can have, for example, you can work 4 days and then 3 days you can be off, and
yeah,
you can work 32 hours or maybe 36 if you want, or maybe later 40 if you decide. Hmm.
yeah.
So that's great. And can you mm, maybe what challenges did you face when you relocate to the Netherlands?
I would say the first challenge is to adjust not only for the Dutch language, but also for a different kind of teamwork. Because in my country, in Italy, um, of course, everyone works in team, especially in the hospitals, but there's a very strong hierarchy. So there are like the responsible doctors, the doctors, nurses, nurse assistants. So you work, of course. You like it's like you follow orders. So I didn't feel at the time when I worked in Italy that I could express myself. While here in the Netherlands, starting from the beginning, so I was like the last in line, the last one who had joined the team. I was asked for my opinion, and that was difficult in the beginning because I was not used to. But it's
Mhm.
very nice as professional to be able to express your opinion.
Yes, I agree with you. And like this, you can also grow in the future.
Sure.
Hmm. So that's great. And you mentioned about this difference between working in Italy and in the Netherlands. Were there or are there any other differences working?
Yes, I would say the flexibility of the working hours. Like in Italy, you sign a contract. Your contract is, for example, for 5 days a week. Then it's very difficult to modify your working hours. Here, you can express your opinion also on these kind of matters. So the flexibility, the possibility to take vacation days when you want. Um, like in Italy, a lot of companies only give you vacation for in August, where everyone goes on vacation, so where everything is expensive and crowded, and for
Hmm.
Christmas. Here, the flexibility is very important, and a lot of attention is given to having a good balance between your work life and your private life. So that's also a very big difference I noticed.
Hmm. Yes, I see. And what else? Maybe one more question. What advice would you give to other nurses who are considering relocation to the Netherlands?
Yeah, I would advise my colleagues, nurses, not to be scared. um, not to see the language, the Dutch language, as an obstacle, uh, but to just dive in this new adventure, and everything will be fine.
Yes, you will get there.
Yeah,
Yes.
sure.
Okay, I see. I don't think that I have any other questions to you, Daniela. Thank you very much. Maybe now together we can have a look at the chat or QAs and answer the questions of our
Yeah,
participants. Let me see. So, Netherlands. Nice to meet you. I'm Elisa Angela. I know there are many nursing jobs openings in the Netherlands. Are there opportunities for Brazilian nurses to validate their diplomas and in the future obtain work authorization? What would you say to this, Daniela?
yeah. So I would say that EMTG at the moment works with um, nationals of the European Union, and that's because the whole process is easier, and European nationals do not need a visa, so do not need a sponsorship. Of course, in the Netherlands, there are a lot of professionals from extra European Union origin, so that's
Mhm,
possible. If you go to the website of the big register, it's BIG, big, like the word English big. You can see the whole process, and it takes, I would say, more than 1 year to finish all the steps to get your extra U diploma recognized. Um, so it's a quite expensive process. So that's why MTG at the moment does not work with extra EU professionals, but it's
yeah.
possible.
Yeah, so this is important that it's possible. Of course, it's a bit longer process, but it's possible to
Yeah,
get the big registration of a non-EU nurse. And another question is, hello, I'd like to know if we keep our entire initial salary or if the agency or hospital takes a portion. I would also like to know if you have any scheduled courses that begin in specific months or if the registration period varies. Okay, so let's start with the salary.
yeah, no,
You will be, yes, you will be employed by the EMTG Healthcare for the 18 months and you will receive the entire salary. So there will
correct.
not be anything that will be taken from your salary.
Yes.
Yes, and Daniela can confirm it as she has worked for EMTG as a nurse. Yeah, for 3 years you mentioned. And for the courses, yeah, EMTG Healthcare has courses throughout the year. The schedule depends on the job offers, on the number of the participants. So if you are interested, you can contact us and we can see what could be your next course that you could be enrolled. hmm So my name is Joel, as a third country national who is a registered nurse currently living in Malta. Am I eligible to join this program? Also, can the language training can be done online with your language training program? Um, in Malta, so as Daniela mentioned, so the process could take longer. Yes, for non-European nationals. Um, Unfortunately, we do not accept the nurses without recognized EU diploma. So this is the requirement of the EMTG, and the course could be also done online, but of course it depends on the job offer. So some job offers have this possibility. So it depends on the location you will be working and the employer. So there is a possibility. So I would like to ask some questions. I graduated nursing from my country, Philippines. For me to be able to work as a nurse there, do I have to convalidate my documents or can I apply as a nurse directly to any hospitals as long as I learn the language fast? So no, as Daniela already mentioned, so firstly you need to be registered in their authorities and get this big number. So the process could be, yeah, as Daniela mentioned, up to 1 year. What is the email? Add to send my CV. Okay, we will leave the email address at the end of this presentation. Yes, but if you are from Philippines, of course you can apply, but not via our company. So you can apply to big in the Netherlands, as Daniela mentioned, and do this procedure on your own. Mhm. So, Miranda, I'm a new grad nurse and I'm interested in migrating with my husband and kids. Is that a possibility, or will I have to send for them after a period of time? So, what do you recommend, Daniela, if a nurse has a family, kids, and husband? Um,
So
is
I
it
would apply, and then during the scheduled meeting that you will have with the recruiter, then the recruiter will explain all the possibilities to you. And it also depends on the job offer that we have at that moment. Because we've had families before moving with children, it's a little bit more difficult because with only one income of, let's say, so starter nurse, it's not possible to provide for a whole family. Um, so your husband should work, should be able to find the work as soon as possible, but it's an option. So I would apply, I would send a CV, and then we can talk about it.
yes. And Joseph is also asking how to process the recognition or registration procedure. Maybe you can repeat it, Daniela, about the big registration. So how should it be done for a
Okay.
person from outside the European Union?
Yes, it depends on a lot of factors. So there's not a standard procedure for anyone, for everyone. It depends on the country where you have obtained your big registration. You always need the NT2. That's the language examination of Dutch as a second language. And then you have to physically be in the Netherlands. That's why I said that it can be a little bit more expensive because, as Natalia said, the language examination has to be taken in the Netherlands, and then for extra European nationalities and diplomas, you have to like succeed in other kinds of nursing related examinations to prove
Yes.
that your diploma is comparable with the Dutch one. And it depends. There is never a standard procedure, but you can go to the website of the big BEG, and there
Mhm.
you can insert like your nationality, where you got your diploma. The website is also in English, and you can see the procedure and if it's convenient for you to start it. Yeah.
Yes, thank
Thank you,
you,
Natalia.
Daniela.
Big registration.
Okay. So any other questions? Mm, I don't see anything else. So I would say that if you will have any other questions, so now I will show you again our contact details.
Sorry,
Um,
Natalia. I think there was a last question.
Okay, just 1 second. I will come back to this. Is you can contact us on info@emtg.nl, or you can apply through our webpage, emtg.nl, or we are also present at social medias. Yes, Daniela has her personal account on social media, so you can find her or mine or the company's account. Just let me come back to yeah, to the question. Just 1 second. Where do I wait? Here, I think. No. What is the most valued in an interview? In the interview, do you ask questions about knowledge or do you assess other things like attitude or motivation? Mhm. Yes, I would say yes. I would say the motivation is very important. Of course, your knowledge as a nurse are also valuable, but the motivation and the attitude towards other colleagues, towards work is also very important. So usually the interviews are very easygoing, so you don't have to stress about them. So it will be like a normal conversation. Yeah, we will chat, we will laugh a bit, so it's no stress. But of course, if you are experienced, we will ask you questions related to your experience and also other questions why you would be interested to relocate in the Netherlands, if you would be interested to relocate alone or with someone else. So there are some questions, but as I mentioned, the interview are usually easygoing. So don't be stressed about the interviews. Just drop us a line, and my colleague will call you or will invite you for a Teams meeting. Yeah, so if you will have any other questions, please feel free to write us. You can write us directly to Daniela or to me or to the general EMTG profile or webpage. So, or you can apply for the job if you would be interested. Yes, you can recommend our company to your colleagues. And if you are not interested now, please feel free to contact us also in the future. Thank you, everyone, for this pleasant time together in this nice evening. So I think maybe last question, Joseph is typing. Okay, thank you, Joseph, as well. So maybe last words, Daniela.
Yeah, thank you. Thank you all for joining us today. As Natalia said, if you have questions, feel free to contact us. And I hope to see you soon in the Netherlands.
Yes, yes, that's great. Okay, great. Thank you, everyone. Have a nice evening. Bye-bye.
Have a nice evening. Bye.
Bye.